All right, thank you so much to everybody for joining us tonight. My name is Jenny Croplin, and I am the Educational Outreach Director for PeoplesRx. And on behalf of our pharmacy, I'd like to be the first to welcome you to our webinar, GI Health 3 Functional Medicine Approaches. During the presentation, you can submit your questions in the chat area. And this way we can answer them during our QA session after the presenters have finished. We would like to ask that you please mute yourselves during the presentations. And once all of our speakers have gone through their respective presentations, your questions will be answered by PeoplesRx compounding pharmacist Deborah Fernandez. Deborah, before we begin, would you like to share a little bit of background on People's Pharmacy for anyone joining us tonight that might be new to what we do?
Yes, thank you so much, Jenny, and thank you for everyone for spending your Wednesday evening with us on the webinar. For those of you that don't know, People's Pharmacy was founded over 40 years ago with the mission of helping patients make educated health choices. And we spend time every day learning, promoting, but also teaching those healthy choices, which is one of our core values here at People's Pharmacy, like this webinar tonight. I am joining the call this evening from our compounding facility here in South Austin. And what makes People's Pharmacy different than most pharmacies or your average pharmacy is that we make customized medications from raw materials for our patients. We just celebrated 1 year in our beautiful new facility here in South Austin. We made this space not only to meet, but also to exceed our state and federal compounding regulations, as well as to meet the growing need here in Austin to provide these personalized medications. So here at our facility, it's only a lab. It's all the pictures that you saw while you're waiting. We don't have any retail space. What we do is we make your prescription here at the facility, and then we send it to one of our 4 retail locations all across Austin. We do offer delivery, home delivery that is, but we actually have an interesting phenomenon here at People's Pharmacy. And what we found is that a lot of our customers really enjoy shopping at our stores. We like to attribute that to the relationships that have been built over the years, that our pharmacists and our team are a trusted part of our customers' healthcare team as well. But also, it's just really a lot of fun to go into our storefronts. We have a plethora of professional grade supplements to choose from, and we have people that can help you through that. But we're going to talk about some of those, a few of those, and how they relate to gut health this evening. I am so happy that we are collaborating with these knowledgeable practitioners about the significance of gut health. In my experience, I feel like this is a topic that mostly goes overlooked by your average patient. But as the research expands, we know that your microbiome is an integral part of your health, your overall health, and of course, your optimal immunity. You can't outlive a bad diet. You have to minimize your stress and get good sleep to promote that good gut function and minimize inflammation. I will be moderating the question and answers at the end of the presentations. So throughout the presentation, if you have a question, just type it into the chat box and we will keep the conversation going at the end of the presentation. So thank you again for being here, and back to you, Jenny.
Thank you, Deborah. All right, so I'm pleased to introduce our presenters. They are all a part of the Austin functional medicine community. Family nurse practitioner Kristine Kjolhede, Dr. Karla Mehlenbacher, and Dr. Omar Akhter, as well as a People's own Doctor of Pharmacy, Kevin Natt. Our first presenter tonight will be Kristine Kjolhede, owner of Thrive Hormonal Health and Wellness, to discuss the role of vitamin D in gut health. Kristine, I'm going to go ahead and turn it over to you.
Okay, terrific. Thank you so much, Jenny, and it's a pleasure to be on with everybody tonight and collaborate with Dr. Akhter and Dr. Mehlenbacher and the staff at Peoples. I have to say, as a new practitioner to the Austin area, I just opened my doors here in Austin about 6 months ago. I've been sending a lot of my patients to People's Pharmacy because the compounding is top-notch, and I just love working with your staff. They're super friendly, easy to work with, and it's just a joy to be a part of this this team tonight as we talk about gut health and the immune system. So what I'm going to talk about is vitamin D, and we're going to kind of do a broad brush. I am not a vitamin D expert. And I'm not a gut expert. That's not my, I'm not a rheumatologist. But what I do is I do whatever I can with my patients to help them better understand the importance of vitamin D, whether they're doing hormone therapy or we're just trying to move them into a wellness, into that wellness zone. So let's talk about your gut and vitamin D and why you need it. Get my presentation going here. All right. There we go. So why do we need vitamin D? Well, first of all, we need it to promote healthy bones. You probably are well aware of the fact that vitamin D is what we refer to often as the sunshine vitamin. You know that with exposure to sun, you make your vitamin D in your skin, and then it promotes calcium production. It also regulates calcium and phosphorus production, and together, you know, that's how we keep our teeth and bones healthy through the lifespan. So you probably know that if vitamin D deficiency can sometimes lead to abnormalities, especially when we think of children. You've probably heard of rickets. We don't see that much in the United States, but it's just a softening of the bones and malformation as children grow. And we can also see it in the adult population with osteomalacia, which is a bone softening often accompanied by pain. But this is from pretty severe vitamin D deficiency over time. Most of us are not that deficient and don't see these types of, you know, incredible abnormalities. But so let's talk a little bit about vitamin D production. I mentioned through the skin, you get the UVB rays that work with something called 7-dehydrocholesterol. And then together, it works through the liver and then through the kidneys through some hydroxylation processes. It looks very complicated, and it is very in-depth. But all in all, we process and produce vitamin D through the skin and also through the foods that we eat. And we're going to get into, in a few minutes here, the importance of the metabolically active form of vitamin D. But this is the initial form that we get through our food sources outside of sunlight. So let's talk about food. And there's two types. There's vitamin D2 and there's vitamin D3, which is cholecalciferol, and vitamin D2 is ergocalciferol. So let's think about some dietary sources. Anything that is animal derived is going to be the cholecalciferol. Anything that's plant derived from your plant-based milks, mushrooms, those types of things are going to be your ergocalciferol. Things like the salmon, over on the left, you'll see that list of dietary sources, and kind of you can see how going up the list, you get into the salmon, the trout, the cod, and those are where you're going to get your really high doses or high amounts per ounce of D2. I'm sorry, D3. So I don't want this slide to confuse you, because anything animal sourced, including the salmon, the fish, that's all your D3s, but the D2s are your plant-based milks, things like that. So we can get it from these foods, but oftentimes what we think about vitamin D is we prefer to see the D3 version. That seems to be where we get the best serum blood levels of vitamin D3 that we want to look at. At least that's what I look at as a practitioner. So we have to activate vitamin D2 and vitamin D3, and it looks, again, complicated, but your body does a beautiful job using certain enzymes to convert the D3 from the sun or certain foods and D2 into the active form, which is 1,25. It's OH2D3, which basically is 1,25 dihydroxy D3. So that's the active form. And we want that activated because it attaches to, you'll see the VDRs, which are vitamin D receptors that are going to be inside each cell in your body. So these vitamin D receptors are what are going to eventually take this activated D into the nucleus of the cell where it can do its job and it exerts its action. And because of its chemical composition, vitamin D, when it's activated, acts just like a hormone. It's extremely important. It exerts a specific action or several actions, and thus we really do think about activated vitamin D as a hormone. And it has many roles. So vitamin D helps in many ways from not only strengthening bones and keeping them strong, but we think of it in terms of our immune response. And in terms of cancer, we've noticed, and research has shown, that there's like a 5-fold increase in cancers of any type with vitamin D levels on the low end of the reference range. And we're going to go into the reference ranges here in a minute. But there was a 2019 systematic review of vitamin D deficiency directly related to breast cancer incidence. So again, we're finding more and more the importance of vitamin D and D3. Let's talk about the cardiovascular system. I'm sorry for that hanging R there on that slide. I don't know how that happened. So in a Framingham heart study, people with vitamin D levels less than 15 nanograms per deciliter were twice as likely to have a heart attack, stroke, or other cardiovascular event. And we've also seen studies that show vitamin D levels less than 60 can lead to about 160% increase in coronary artery disease. So we need vitamin D for acute cancer prevention as well as cardiovascular health and disease prevention. And we also, like I mentioned earlier, think of it as a hormone. It's important in androgen receptor health. Androgens are like testosterone. Vitamin D plays a crucial role in keeping the receptors for testosterone and other androgens healthy. The metabolism of hormones, and of course, like I mentioned, it acts like a hormone. With the immune system, there are direct and indirect regulatory effects on the immune system. We want to think about T cells. You probably heard of those. It promotes the regulatory T cells, which can prevent inflammatory responses in certain cells. And we've also found that D3 does reduce monocyte activation, another part of your immune response. So it's really a regulator and also supports your immune system. So let's talk about the immune system in the gut, and then we'll talk about what vitamin D's role is. But you probably heard this before, but that about 70% of your immune system does exist in your gut with the microbiome. There's a direct relationship, and they're intricately connected. Just like there's a gut-brain axis. I'm not going to go into that, but right now I'm going to focus more on this immune gut relationship. And I found this graphic. It's a little bit crazy looking. Don't be too intimidated by it, but it really does tell the story, and I'll walk you through it. But if you see at the top there, it's got the vitamin D gradient. So you've got more vitamin D at the left end and less on the right end. So what we found that is when vitamin D levels drop off, you see more invasive pathogens able to make their way through those tight junctions. You can see the tight junction there in the middle. And these are extremely important. And you've probably heard of leaky gut, but as your vitamin D levels drop, you find these tight junctions don't hold together as well, and it allows more more immune response mediators and immunoglobulins to make it into the intestinal lumen, creating havoc, pro-inflammatory type things like the B cells and the plasma cells and these interleukins that can send signals that cause inflammation. So we want to keep those vitamin D levels on the high end of the reference range to protect the microbiota of the gut. You can also see in that left lower box how vitamin D works with things like short chain fatty acids to upregulate T regulator cells and B regulator cells. And these are anti-inflammatory cells in the gut that keep things under control. So that's that vitamin D link that's important in the gut. At least this was like the best example of a graphic I could show you to kind of help you understand how it works. So how much vitamin D do we need to be taking? Well, according to the Mayo Clinic, and this was what I found from this year, the recommended daily allowance of vitamin D is 400 IUs for babies and infants up to 12 months, and then 600 for ages 1 to 70, and 800 IUs for 70 plus years. Now that's the RDA. This is not how I practice. And what we found is if you're taking this level of vitamin D3, you're not going to be getting enough unless you're getting extremely high amounts of sunshine and eating tons of salmon every day. So how much vitamin D3? So the new research really does recommend that you take, if your serum levels are above 40, you're in the moderate, the center in the reference range, and 5,000 IUs daily is recommended. 10,000 IUs daily is what I prescribe for my patients if their serum levels are below 40. And I'll do that dose for a good 3 to 6 months, and then I'll decrease it to 5,000 daily. So that's, and I will do blood work to check and see where levels are, but typically about 3, unless you're severely deficient, about 3 months on 10,000 IUs a day is good. But now there's even more new research coming out that 10,000 IUs daily all the time, all year, is not going to cause vitamin D toxicity. So how do you take it? When you take a vitamin D supplement, it's best to take it with a fatty meal or after you've eaten. It is a fat-soluble vitamin, so we really want to take it with other fatty foods to be sure that that activated vitamin D ends up going into the cell, because if you remember, cell membranes are made of cholesterol, a fatty substance, and fat begets fat, and the vitamin D will roll into the cell and do its job if you take it with fatty food. We also want to combine D3 with K2. What this does is it moves calcium to the bones and the teeth and removes calcium from the arteries and soft tissues. I'm going to come down here to a note I made on this because I want to be sure I get this. There's still a lot of research being done on how much K2 we should be taking, but research suggests about 180 to 500 micrograms daily is enough to activate those K2 dependent proteins that work along with D3. And what K2 also does is it prevents D toxicity. So that's what we love to marry the two, which is so important. And then one of the supplements that I offer in my office also includes vitamin A. So when you combine D3, A, and K2, it helps dispose of excess calcium via the kidneys. Also plays a good role in bone remodeling when you add vitamin A, and it synergistically supports the immune system because vitamin A is very important to the immune system as well. That's a whole other topic. So there's so many choices out there. I just wanted to show a slide of a couple, and I know that Kevin and some of the others on the staff at Peoples are going to explain some of the other ones that they carry, but I work with Avexius. I also use some orthomolecular products, but 80K together, that's a 5,000 milligram in the lower left. And then there's the Da Vinci Labs, that's a great brand. They have an 80K, and then there's the Designs for Health, which they'll talk about a little bit later. But that's a wrap. I wanted to make it kind of short and sweet and give you the opportunity a little bit later to ask any questions. Just just all around wanted to let everybody kind of get a sneak peek at why D3 is so important, how it's made, and the amount of vitamin D3 that you should consider adding to your regimen, of course, with the advice of your practitioner. So, okay, that's it. I'm gonna hand it over to Jenny.
Thank you so much, Kristine. That was great information. And just as a reminder to everyone listening, go ahead and feel free to submit any questions through the chat, and we'll be sure to answer them in our live QA. Our next presenter is Dr. Karla Mehlenbacher, owner of Take Root Brain and Body Development, to discuss the gut-brain connection. Karla, thanks so much for being here. I'll turn it over to you now.
I'm not sure why it's not letting my video on. Is it stopped on your end?
Let
me try something else.
Sure.
Is it working? Okay, yay, hi.
Hello.
Can everyone hear me okay? Yes, okay, I saw heads shaking. Cool, it's nice to meet you guys. I'm gonna turn on my screen. Sorry, I'm getting there. Okay. All right, can everyone see that? Yeah? Okay, hello guys. And you can still see me, yeah? Okay. Sorry, I'm trying to like see you guys at the same time and I can't. Oh yeah. Okay, we're here. So I'm going to talk about the brain connection to all of this. I know that there's a lot of focus on the immune system and what you're eating and nutrition, but I'm kind of going to give it a different spin. Some people have heard of this concept, and a lot of people are still just now conceptualizing how much our beliefs and thoughts and ways of living are affecting our gut. So I love the statement from Stephen Porge, the body's oldest systems are the key to solving our newest problems. And I'm going to get into why that is. So a little about me. I am a board certified chiropractic neurologist. There are not many of us, but we do exist. So I have a fellowship in mild traumatic brain injury and vestibular rehab, as well as childhood neurodevelopmental disorders. My journey to get to this point was not linear. I was fully pre-med. I wanted to be a real doctor, and I got sick. I found out I had thyroid disease, positional orthostatic tachycardia, which is a form of dysautonomia. I found out way later that I had chronic Lyme and all these infections, so a lot going on with my gut. So it took me to the more lifestyle choices and holistic ways of really fully getting to the root of my problem. I also have some advanced training in, like I said, my primary treatment, I normally work with people with things like concussion, brain injury, childhood developmental disorders. So on to the main topic. Why do we have a nervous system? I know this isn't an open mic, but I normally let people answer this question. So the answer is because we are moving creatures. So we are very similar to plants, trees, other living life forms, but why do they not move? Because they don't have a nervous system. So the whole fundamental reason that we even have a nervous system in a brain is because we have to take in the environment, perceive the environment, and say, how do I appropriately respond to that environment? So it all goes back to movement. Right, and I'm not going to read through these slides. I'm going to let you guys do that later, but more details are in the wording. So what ultimately makes us feel safe? This has been something that's only recently really been digging into. Classically, we've been told that we are either in a state of fight or flight, sympathetic, right? Blood is going to my limbs and I'm trying to survive or move or run, or we're in a state of rest, digest. So parasympathetic, my body relaxes, I want to breathe, digest, all those nice healing things. Now we're learning that it's actually much more complicated than we previously thought. And this has only really been since the 90s. So big picture of my main point I want to bring home today is that there are basically three main layers. Polyvagal theory is the concept created by Stephen Porges. This was, again, only in the 90s. But if you've ever heard of the vagus nerve, it's gotten a lot of attention because it's our rest digest nerve. Well, now we're learning that it is much more multidimensional, which is poly. Poly means multi. So it's not just like a direct connection to the vagus nerve. So as you see here in my little infographic, I'm going to kind of go through it on a physical level. When we're talking about safety, our first, as humans, as an adult human, I should say, not children that are still developing, as an adult human, my first layer of safety is social engagement. So do I feel safe with the people in front of me? Am I going to be attacked, right? Dogs are very good at this. You can see them, it's very obvious. They'll like sniff each other and they circle each other and they're like, are you cool or not? And they spend like a whole minute figuring it out. Well, humans do it in microseconds, and it's determined by their eye movements, their body movements, their frequency, their sound, their smells, everything, right? It's not just video, right? So I'm not even getting a feedback from you guys right now, so I don't know for this social engagement part. The next section is challenge or mobilization, and this is where I would say probably a majority of us spend our time in our culture is like, okay, I don't feel safe. My boss said something. I need to survive and make money. So I'm in challenge, and I'm in that sympathetic flight. So I'm really referencing this bottom part of the chart here. So this is that classic sympathetic. Blood goes to my limbs, and I'm like having to move, right? So that feeling of anxiety really sits here. So when we talk about anxiety, like what are we really saying? Well, really anxiety is like, I need to move. I need to get out of this. I'm not safe here, right? The final layer is our most primitive, which is the dorsal vagal. And this is below the diaphragm. So above the diaphragm is your heart rate and lungs, right? We can do meditation. We can regulate this. But then below the diaphragm is where we don't have control over it. It's unmyelinated, meaning it's just spontaneously firing based off of where we're at in our whole system. So we don't have control over it. So this is where we say you disassociate, or you actually will shut off. So a great physiological example of this is when you're held gunpoint and this person just loses their bowels. So it's so primitive, they go straight down to the most primitive reflex of just shutting off. It's our reptilian reflex, actually, because it's in the brainstem. Reptiles can go down to a point of not having oxygen and come back with no remorse, right? They don't have injury. Well, we can't have that level of lack of oxygen without consequence, especially chronic shut off. And this is a big thing with kids, right? Because kids cannot mobilize out of the situation, so they shut off. So I'll get into that a little bit later, but those are the big picture here, right? So like, how do we feel safe? As humans, the ultimate level of safety is being in community and connecting. We are tribal. If I don't feel safe with the people around me, I'm going to be stuck in that I can phase. And when, as she mentioned before, when we're in that I can sympathetic phase, it's a brain connection that actually will separate the tight junctions in the gut. So the gut barrier is, again, it's mobile. It goes back to movement. I can't digest the food if I'm not getting blood and oxygen and movement into the intestines. So it will actually cause leaky gut if you're in that I can phase. And then shutting off is where we actually chronically do this, and we numb out and we disassociate from our body. So I'm not going to go through each of these, but this is the kind of anatomy breakdown of this. The one that I was saying above the head is the one in green. So this is our cranial nerves, the vagus nerve that's always talked about, but it's also not just the vagus nerve, it's the ocular motor nerves, it's the facial nerves, right? So that's why we grind our teeth, we move our tongue and the same in reverse when we're relaxed. We eat and we're hungry and we want to eat, right? That's all relaxing things, but the opposite is locking up. And then you'll see like the sympathetic chain is this yellow one, and that's where it's our spine, right? This is where chiropractors love to talk about getting you out of your sympathetic by, moving the spine and getting that movement out. And this is why movement is not a bad thing. It's actually a very healthy thing, especially if you are in a state of fight or flight and you're not moving. You are not getting blood flow to that area, which is the red one, which is the parasympathetic, but the dorsal branch. And this is the one that functional medicine people are talking about, because so much of that branch is going back up to the brain and saying, hey, we're good down here, or we're safe down here. So the way I like to describe it, actually don't want to use that one. I'll go back to this. The way I always like to describe it is like a pyramid. So when we're talking, like when I tell this to patients, they're always like, what do I do then? Like, what is it? Is it my childhood trauma? Is it my food? Like, where do I start? So I always like to say, well, think of it like a pyramid. So below the diaphragm is the microbiome, and that is the foundation. And this is where, just like babies develop, that's why I love working with kids, just like babies develop, we don't get to that point of being able to think about our emotions and our thoughts until our physiology is good. Then we can talk about our motor control. Are you moving your body? Do you have appropriate reflexes? Has anyone assessed your nervous system to regulate, hey, maybe this is going on in your nervous system constantly. Maybe your ears and eyes are perceiving sound and light inappropriately, and it's making you be in fight or flight. This is big with ADHD. And then socially, what's going on, right? That's the top of the pyramid. So the final aspect is like, are you connected? Do you feel safe with others? We are tribal, and this has been studied to no end. The longest study on humans ever was out of Harvard, and they tested these freshmen all the way up until their 70s, I think maybe 80s. And they assessed that the one fundamental thing that made them have a healthy outcome was having relationships. It didn't matter how much money they made, it didn't matter their success in life. It goes back to their relationships. So when we are isolated, we will start to go into fight or flight, right? Because that social aspect, we need each other to self-regulate. And this isn't just like, you know, people say like, oh, I shouldn't need people. I should just deal with this myself. Like, no, that like fundamentally, anatomically, you literally need people, right? As babies, we cannot survive without our parents. And it still goes on throughout life. But it's the chronicity of it. How long have you been sitting in that state of not feeling safe? So this is where the immobilization part connects with the gut, right? So if I'm in a chronic state of not feeling safe, then we can actually create leaky gut. And so this is the conversation of like the gut-brain connection of which is it? Is it the chicken or the egg? Did my stress and nervous system cause my immobility to my gut and below my diaphragm so that I don't release enzymes, I don't produce the appropriate nutrition that needs to happen down here because I'm just not getting blood flow down there. And then we get things like IBS, intestinal bacterial overgrowth, SIBO, leaky gut. All of these things are a side effect of, it's the chicken or the egg, right? Was it the pathogen? Was it the toxin? Was it the vitamin D deficiency? Or was it a mix of both, right? Were you susceptible based off of not feeling safe? And did you become opportunistic to bacterial overgrowth and leaky gut? Or was it truly that a pathogen took over your system and made you not feel safe, right? So it's both. And looking at both, I think, is the biggest picture, is we can't just look at one in these situations, especially when it's really chronic like this, right? If you get sick, if you get food poisoning, you get E. coli, your body expels it, it figures it out right away. But with these chronic things, you have to start looking at your nervous system and your socialization, because you are missing a huge piece of the pyramid if you're just focusing on your diet. This is just a graph I put in here so that you guys can look at, but this is basically showing what the difference is between sympathetic versus parasympathetic. So if everyone has felt it, but you get that tension in your mid back, like I'm so tight in my shoulders, that's because that's where the sympathetic chain is. Same with grinding your teeth, right? Same with the pupils, like getting light sensitive, getting sound sensitive. Our eyes will literally start to come inwards and we'll start to see double vision because we're stressed. It's a reflex. And then the vagus nerve is the one that's called the wandering nerve, which is why it's not just one nerve. It branches off, but it's what controls our digestion. It's what tells us, okay, we're going to even have a libido. This is what controls our bowels and bladder, right? So if you're constantly constipated, it could be gut bacteria, probably is, but it could be related to this nervous system chronically not letting you actually relax and dilate. So you guys can look through all of that. This is just something I put in here because a lot of people talk about the enteric nervous system is a part of the brain or a part of the nervous system that people say 80% of the gut goes to the brain, right? That's what we hear all the time. Like, it's what you're eating. It's what you're eating. this is basically just a clip from an article saying like, it isn't just what you're eating. It is bi-directional. It is also depending on how safe you feel in your body. This is the part that I kind of wanted to loop back around to. People that have adverse childhood experiences, this is one of the most studied things that we have on this. But basically they rated up to 10. There's like neglect, abuse, divorce, moving, really what are considered traumatic or adverse experiences for children. If you have 4 or more, your risk of diabetes is 1.6 times more. You double your chance of cancer and heart disease, and quadruple for chronic lung disease. So basically what they said is, if you have an adverse childhood experience, you are shutting off the system chronically, because it's now like a plastic memory of your brain, that you are more likely to become opportunistic to these things entering your system. So going back to my story, I definitely did all of the Western medical things, right? I took all the antibiotics, I was on IVs, I did all the things. I had thyroid surgery, I got my wisdom teeth pulled, I got all the things, right? And then I was still having stuff come up. And I was so frustrated because I'm like, I'm doing all the things. And you're just telling me I'm going to be on drugs the rest of my life, and I still feel like crap. So it was, yes, I definitely had to clean all that stuff up. And I did get better by taking the antibiotics and doing all the things. But what made me actually heal was really getting to that nervous system level of, how am I regulating my nervous system? Do I feel safe in these settings? And am I in a pattern from potentially from childhood in my relationships that is perpetuating this to continue to not fully heal, right? So it was not until I really got and sat with myself and my life and my story and everything and the way I live and the way my environment I put myself in, that's what really helped me heal and finally get to a place of fully healing. And I'm not on any drugs or any medication. And I don't overanalyze my diet. I fully believe in those things at the time. But my point in speaking today is to bring that other perspective of this, of like, yes, it's both. It's not one or the other. It's looking at what makes you feel safe. Do you feel safe, first of all? And then let's dig into like what that is. Is it your microbiome that's making you not feel safe? Is it your nervous system regulation? Is it your relationships and connection, right? So sometimes it's a mix of both. Sometimes it's one primarily for one, and you kind of start peeling back the layers, but the foundation is the microbiome. You can't have healthy relationships and, depression, anxiety, all those things. It's like the first thing when someone comes to me with anxiety is I'm like, let's look at your gut. What's your physiology? Because it's the foundation of your pyramid. And it is true, 80% of your neurotransmitters, serotonin, are produced in the gut from the bacteria in your gut. So it's a relationship with them. It's not like an enemy. They are there for our benefit if we don't allow too many toxic things in to fight with them, right? So giving the space to produce the neurotransmitters. And then I did want to bring in I have a whole list of ways that you can activate the vagus nerve or this system. But I put 4 on here just so that you guys can have something to take away with you. Positive social relationships is, of course, the top of the pyramid. This is not often the first thing to jump to. That's why balancing the gut microbiome is on there. So going through the hierarchies, but just knowing, sometimes I have patients that just really don't like socializing and they validate it, right? They're like, I just don't get along with them. It's just who I am. And I'm like, okay, 20 minutes a week. Just commit to being in front of someone face to face, feeling their body, not in a video, and just talk, right? And that is so healing eventually. It's not that you don't all of us want connection. If you are in that place of feeling like, it's too much, then maybe go back to regulating your nervous system by yourself and doing those tools that can help regulate yourself and going back to the microbiome first. So those 2 are obviously my biggest ones. And then these are some nice ways that you can regulate that middle section, right? So humming and chanting, because our vagus nerve is what starts us to chew food and swallow. It's also connected to humming and speaking. This is why we actually feel better when we yell. It's a reflex to yell. It's why kids yell. It's why kids scream. It's literally a nervous system reflex to calm our heart rate down. So when we activate this, and the way to think about this is like, if someone was chasing after me, I'm not going to be able to talk to them. I'm just shut off and I'm running. If I'm at a place of being able to talk, I have to feel safe enough to put my guard down. So that's why talking actually makes us feel better. So humming is a really great way because you're vibrating those deep throat muscles and it really activates our system. I always tell people too, like, go outside and scream. It's very primal and it feels good to get it out. 4 in and 8 out breathing is great for 2 things. So it's really good for extending your exhale. When we inhale, and this is why the sympathetic and parasympathetic is not so black and white. Breathing has often been described as like, oh, it's a relaxing technique, but there's a lot of breathing exercises that activate your sympathetic system actually. The way to think about it simply is inhaling is our fight or flight. Exhaling is our rest digest. So inhaling, sympathetic contraction. Exhaling is dilating, relaxing. So when we know this, we can use this and say, I'm going to focus on my exhale. So if you're anxious or stressed or you're even constipated, you can focus on extending your exhale. This is also good for acidity levels. I couldn't say that. So when you're exhaling, you're actually letting out more carbon dioxide. So it's also helping lower the stomach acid because you're extending your exhale and it's making you become less acidic and more alkaline. With the breathing, you can also hum on the exhale. That's what I often tell people to do. So you're getting double whammy. Cold exposure is another really easy and really great one. This is something I tell like all my kids that have anxiety, bring an ice pack with you to school and tell your teacher to keep it in the fridge and put it on your face. So you can do full cold exposure with a shower or a lot of people are doing the cold plunge now. The science behind this is when we were in our amphibian state, our primitive brain, right, our reptilian brain, if we were to dive into a water, our brain knows we're about to lose oxygen, so it lowers our heart rate because it knows we need to preserve oxygen. So if we feel cold, it's a reflex for us to be like, okay, we need to preserve oxygen. We don't have much left. So it's actually an immediate way to lower your heart rate. If you can't handle like a cold bath or a cold shower, put ice on your face. Just grab an ice pack and put ice on your face, or even just put your hands in cold. But really splashing it on the face activates that cranial nerve reflex. And then getting to the point of being able to do a whole cold plunge is actually the goal. You know, a lot of people can't, especially if you have like fibro or something that's been you're really in a lot of pain. You might not want to jump to just doing a cold bath, but knowing that that's the goal. And if your heart rate variability is so low, which heart rate variability is the best way we measure this now. See, I even have my Oura ring, which measures my heart rate variability. And the lower your heart rate variability is, the less you can handle extreme changes. So working out is probably difficult. Cold temperatures are difficult. Any extreme change is a lot. We want to be able to handle change. We want to be able to handle those extreme things. So getting to the point where you can handle it easily without much stress is like ideal. And that's when you know I'm getting blood flow to my gut. I'm getting mobility to all of this area, right? Everything feels good. So those are just some ways. And I have, like I said, I have a whole list of ways. And this is individualized, right? It's not everyone does these things and they're going to get better. Some people, it might be visual. It might be that they're getting, their inner ear is stimulating them and triggering them and they can't shut off low predatory sounds. And they're constantly in a state of fight or flight, right? This is big with ADHD or focus issues. It might be visual for someone. It doesn't always have to be your gut, is my point to this. It can be, it's the foundation. But sometimes this feeling of not feeling safe is something that might be just developmental, that you just were never aware of and you just been dealing with it. So that was a lot, I know, and I probably rushed through it, but I am so grateful to be on here. I do have a little quiz that I recently published that can help you. If you do the quiz, it'll help you determine like, do I have more of a nervous system issue or do I have more of a microbiome issue? So I'll provide that and you guys can see and just play with like, maybe this is, you know, oftentimes it's both. It's not one or the other. But my whole point of this is looking at all of it is what's really going to get you to a place of fully being empowered and free to live the type of body and nervous system that you want. the microbiome is the foundation though. So it's the chicken or the egg. It goes back around always. So I will leave it back to Jenny. I'm going to stop sharing my screen. And if you have any questions, please let me know.
Yes, thank you so much, Dr. Mehlenbacher. We appreciate you being
I
here.
couldn't see myself the whole time, so I'm like, I don't know what I was doing, but
you look fabulous. And again, like Dr. Mehlenbacher said, please feel free to put any questions for her in the chat. And all of our practitioners that are presenting tonight, their contact information is not only available on their individual slides, but I'll be putting that up towards the end of presentations as well, so you can be sure to connect. Our next presenter is Dr. Omar Akhter, owner of Madina Medicine, and he's going to be discussing autoimmunity and GI health. It's a pleasure to have you here tonight, Dr. Akhter. Take it away.
Thank you, Jenny. I'm just going to open up my slides. Okay. Can you see that, Jenny? Okay.
Yes, I can.
Okay, great. Okay, so good evening, everyone. My name is Dr. Omar Akhter, and I look forward to speaking with you all tonight. I want to thank People's Pharmacy for putting this together. It's such a needed conversation, and I hope that we have many more. So since time is short, I'll give a brief introduction on myself and then dive right in. So I completed my internal medicine residency in New York City, and I worked as a hospitalist in the inpatient setting in a large hospital system in New Jersey. And this is where I really became familiar with our conventional healthcare system, which is good in situations of acute illness. But I found it fundamentally lacking when it comes to patients with chronic illness, who often need more of a holistic approach to help them heal. And this is where my desire to heal patients diverged from the setting that I was working in, which is the inpatient setting. And then a few years ago, I moved to Austin, and that's where I started my private practice, where I'm able to see my goal of a kind of a holistic practice come to fruition. And that's what I'm focused on now. So the way that our conventional model is set up is that it really divides the body up into separate systems. And physicians end up specializing in these areas, as you know, commonly all of your specialists. And this can be a very good thing in some ways due to the explosion of knowledge that we've had in recent decades, where we need people to specialize in certain areas. But there can sometimes be a tunnel vision that develops with specialists that results in them not being able to look beyond their system. And what we now know with chronic disease is that the body doesn't really neatly demarcate itself into these categories that we've created. And what that results in is the patient being often shuffled between different providers of different specialties when they're searching for answers, and often not being able to get not being able to get answers, and that can be very frustrating. So I'll show this slide, and it kind of shows that tunnel vision that I'm talking about, where if you look at things in that way, then oftentimes the bigger picture can be missed. And so my question is, who is that person that's looking at the patient as a whole? Who is looking at things from a bird's eye view and putting everything together? Because so many patients are in need of that now. So I'm going to be talking about autoimmunity briefly this evening. And obviously, it's a very vast and complex topic, and we could be talking about it for hours on end. But I just want to give you a little outline, as well as a few take-home clinical pearls, hopefully. So first of all, why are we talking about autoimmunity? Why is it important? Well, for one, it's becoming increasingly more and more common, with many people suffering symptoms that they're not able to find relief from due to an autoimmune condition. The rates are skyrocketing, and we have many practitioners who are just finding it left, right, and center. And so it's really something that we need to talk more about. Now, autoimmunity is basically your immune system activation against self-tissue. So our immune system works night and day, keeping us safe from microbes, toxins, chemicals, and so on. But when that process malfunctions to attack our own immune system, our own tissue, that's when autoimmunity has occurred. So you will always need a genetic predisposition, and this is not simply just one gene, but a combination of genes along with an environmental trigger for autoimmunity to come about. These triggers can include infections, toxins, chemicals, hormone changes, and major stressors as well. For example, if all of us were exposed to a chemical, some people would be completely fine, and others would develop an autoimmune disease based on our genetic predispositions. And the hormone changes and major stressors also can show why someone like a woman who gives birth, down the road she can be diagnosed with something like Hashimoto's disease, because that process of that the major hormone shifts and the major stressor of birth can bring about that autoimmunity, can turn that on. Now, I put some main autoimmune mechanisms here, and obviously there are many more mechanisms, but I just wanted to mention a few. And for time's sake, we can't discuss all of them. But the key point that I wanted to highlight here is that there is a certain naivety that we have when it comes to practitioners in dealing with autoimmune disease. And this includes both conventional and alternative practitioners, where there is this idea that, let's say in the conventional system, if you're a patient with rheumatoid arthritis or any other autoimmune disease, and you present to one of the conventional physicians, then using something like methotrexate, a strong biologic agent, to really just try and shut down that immune system, that's that kind of more simplistic, naive approach in my mind that ends up happening. There's certain times that those biologic agents and things are needed, but there's often not that deeper either awareness or concern of what is the immune dysfunction in that particular person, and should we be looking at it, or why aren't we looking at it? So that occurs with conventional physicians. With alternative practitioners, there's also that that naivety where the thought of, okay, if we fix your gut, your autoimmune disease will be fixed. And again, that is a much more of a simplistic way of looking at it. And not everything really starts in the gut necessarily. It can most of the time, but not always. So I wanted to include a few different mechanisms here to really show how varied the development of autoimmunity can be. So for example, if you have depressed white blood cell production, that can lead to immune dysregulation because you need healthy white blood cells to regulate T cells and help them functioning properly. You can have certain infections like Epstein-Barr virus that evade your innate immunity and your initial barrier defense mechanisms, and we call these stealth infections, and they end up upregulating the immune system chronically. That can eventually lead to activity against self-tissue. Then you have something like chemical binding to tissue proteins. So this is an example where you can have certain chemicals that bind to structures like your DNA and change their molecular structure. And once that happens, your immune system will recognize them as foreign antigens, not self-tissue. And then you can have your immune system attacking your own DNA. An abnormal microbiome can contribute to autoimmunity, and even brain injury leading to dysautonomia can result in immune dysregulation. So these are some of the basic mechanisms, and amongst others, that can occur. So one important concept in autoimmunity is self-tolerance. So tolerance is a concept where basically tolerance is the ability for your immune system to be able to differentiate between foreign antigens and self-tissue. And when you lose this ability, when your immune system loses this ability, that's when autoimmunity occurs. So you can see in this slide, you have triggers like pollutants, toxins, hormone changes, dietary proteins, infections, and stress that all result in immune dysregulation, and down the road they result in loss of tolerance. And then you have your immune system producing antibodies against its own tissue. Now, this can be separated into silent autoimmunity or more like autoimmune disease. What silent autoimmunity really means is that you have evidence of tissue antibodies, for example, thyroid peroxidase antibodies in Hashimoto's or other antibodies, but you do not yet have tissue destruction and symptoms present. So that is really like the first stage of autoimmunity. And then through various mechanisms, some of which you can see here, like NF, kappa beta, Th17, when they get involved, that's when someone can go from just a silent autoimmune state into symptoms and eventually autoimmune disease as well. So tolerance is a very important concept. Now, I included this slide just to show kind of a diagram where you can see that autoimmune disease can really affect anything from our head downwards. So you can have autoimmune disease, affecting the brain, and really all organs can be involved. And then you also have some systemic autoimmune diseases which are not specific to a tissue or an organ, but they are systemic and can involve the whole body, such as lupus, Sjogren's syndrome, rheumatoid arthritis, etc. Some of the most common autoimmune conditions that we see are Hashimoto's, thyroiditis, type 1 diabetes involving the pancreas, inflammatory bowel disease affecting the intestines, psoriasis affecting the skin. So these are some of the common ones, but really any tissue can be involved. Okay, so there's an interesting research of where we're looking into over the last few years in autoimmunity. And so some of the common disorders that we really don't associate with autoimmunity, such as autism spectrum, infertility, recent papers have shown that there can be an immune basis for development of these conditions. So there is some evidence that immune dysfunction likely plays a role in the etiology of autism spectrum disorder, where maternal autoantibodies and inflammation during gestation can then increase the risk of having a child with autism spectrum disorder. So this was from a paper in Frontiers in Clinical Neuroscience in November 2018 that suggested this immune basis. So I wanted to include this here because if we start looking at it as having an immune basis to some of these common disorders that we deal with, that would definitely have us looking at these conditions very differently. Other disorders that I haven't included here but worth mentioning are, for example, research on obsessive compulsive disorder and antibodies against the basal ganglia, even narcolepsy and epilepsy they're starting to look into. Again, a lot of this is theoretical, but it's certainly very interesting when it comes to how we view these disorders. So when we talk about autoimmune disease and what are the key factors, diet is certainly at the top of the list. And so I wanted to speak briefly about diet, and because it's one of the key factors that we can use to help autoimmune patients get better. But it's important to understand a few key concepts on diet in relation to autoimmunity. So, and this kind of ties into the holistic aspect of care I spoke on at the beginning, where you need diet, nutrition, lifestyle, all of these things when you're dealing with a patient with chronic disease, especially autoimmunity. So, so now important to note that when we talk about losing oral tolerance, losing tolerance as a whole, part of that is your immune system getting triggered by food antigens. And many people have foods that when they eat, their autoimmune condition flares up, and other foods that make them feel better. So a few key things to note are that dietary proteins actually change their antigenicity depending on whether they are raw or cooked. Now, what this means is that your immune system may react to a food when it's raw and may not react to a food when it's cooked, because at that higher temperature, the molecular structure changes, and so it becomes a different protein. And this is important to also note when a lot of practitioners do food sensitivity tests, where a lot of times they're checking for the raw foods and not really checking for cooked foods, because you can have a reaction to one and not to the other. So it's important to also choose tests which look at both cooked and raw. Dietary proteins can also cross-react with other food proteins. Sometimes the individual ingredients in a particular food are not problematic, but when you combine that in the entire food in a real world setting, that can be problematic. And dietary proteins can also cross-react with body tissue proteins. What this means is that there exists, for example, molecular mimicry, where if you take gluten, for example, the gluten molecule is very similar to your thyroid tissue. So when you consume gluten, your immune system gets activated, it can actually go and destroy thyroid tissue as kind of an innocent bystander, because their structures are so mimicking and they're so similar to each other. Now, I included this picture down here at the bottom of the slide to show an example of amino acid chains. So when your immune system is reacting against a certain food, it's really reacting against the food's amino acid chain when you get down to it. So there are foods that are very similar in amino acid sequences. And so if you can have a food that you consume that your immune system is active against, yet you can also have a food that you don't consume, but because their amino acid sequences are so similar, your immune system can react against that as well. And that can show up in the form of a food sensitivity test, where a food shows up that you're sensitive to or allergic to, and you don't eat that food, and that's because you eat something that is similar in molecular structure, in amino acid sequence to that. So just an important clinical point to note. Now, what is the connection between autoimmunity and gut health? Really the main topic that we're talking about. So as mentioned before by Kristine and Dr. Karla, that 60 to 70% of our immune system resides in the gut. And so we know that now. And so the bulk of our immune system resides in the gut. So there's this very close interaction between the immune system and the gut. So SIgA, or secretory IgA, is the primary immunoglobulin in our intestinal mucosa. And it's really the first line of defense in response to the antigens coming in, as well as the pathogens in the GI tract. And the respiratory tract too. So this SIgA, as we call it, plays a major role in maintaining balance in the microbiome, protecting against exposure to food-derived antigens. And this is actually something that we can measure in our tests that we can do. What is someone's level of secretory IgA? It may not always correlate with symptoms very closely, but it's definitely measurable. So when we're talking about the loss of immune tolerance and how that leads to the development of autoimmunity, the connection with the gut is that a few key gut-related aspects can actually help to improve immune tolerance. So when we have intestinal permeability, otherwise popularly known as leaky gut, you can have tight junction breakdown, and now all of a sudden those antigens that should not be getting into the system are starting to get absorbed into your system, and then the immune system is becoming active against it. So that's a situation in which you may have to fix leaky gut with supplements or nutraceuticals such as L-glutamine and other compounds that can fix that if that's the situation in someone, in a particular person, and that can help their immune tolerance. Another factor directly affecting immune tolerance is the gut microbiome diversity. And I think that the one takeaway probably from this entire evening should be that we should always aim to have as diverse a gut microbiome as possible, because we know, research, a ton of research showing that, whatever we think about gut health, otherwise, a diverse microbiome is the most beneficial thing you can do to help yourself from not just autoimmunity, but generally all disease and chronic illness as a whole. And we're starting to see the microbiome in relation to diabetes and blood sugar control and many, many other, even mental health, and the talk about depression, anxiety links, and those types of things. So the microbiome, that research is exploding, and that is a very important aspect to remember. So, and I'll just get to that very shortly of how we can increase our microbiome diversity. So I spoke about dietary considerations and just diet in general a little bit with autoimmunity. And, I want to be able to give some key takeaways. And so when you have a patient with autoimmunity, or if you are a patient with autoimmunity, what's important to remember is that diet is going to play a huge role in your care. And that involves looking at what diet you're going to use. Different patients are going to need different diets depending upon their motivation level, depending on what they're able to do, what their food intolerances are, and so on. But I generally look at it as someone who just needs some dietary modification, and that would be removing gluten, dairy, and some processed and fried foods. And these are just some basic antigenic, allergenic foods that are the most common culprits when it comes to immune system overactivation. So removing them can be a great first step and really help a lot of patients initially. When you look at level 2, you're going to be looking at more of a paleo diet, which is removing the above plus all grains and some GMO proteins. And then probably the most restrictive diet is to remove all those things and also remove lectin and nightshades, which are compounds that a lot of people wouldn't be able to tolerate with autoimmunity. And you can see patients that will say, I ate tomatoes and I ate eggplants, and my autoimmunity flared up, or my condition flared up. And so there are those patients that will need to temporarily remove these foods to be able to avoid a lot of those triggers that are affecting the immune system in the first place. Now, one thing that ends up happening with excessive dietary restriction is that we end up, when as practitioners and patients, we talk about removal of foods, we end up with our patients just thinking that there's so many foods that they aren't able to eat that they end up eating the same thing every day. And this is probably one of the worst things that we can do, because we really need diverse plant fibers in our diet to ensure that we have microbiome diversity. So that's the single biggest thing that you can do to improve microbiome diversity, is to include different plant fibers of various different colors and all of the benefits that they contain. You can literally go to the produce section of the grocery store, pick out different ones, especially ones that you don't eat commonly, because you want to keep rotating those foods and even mash them up and use it that way. So there are various ways that it can be done, but the point is to be getting a diverse array of fruits and vegetables of different colors into our diet to promote that microbiome diversity and ultimately better oral tolerance, better response to autoimmunity. So those are a couple of the key things with dietary on the diet side. Now, I wanted to include a quick mention about sleep, because there is obviously a huge there's a lot of things that we can do when it comes to helping someone's autoimmunity and looking at a patient and all of the things that we can do from a diet, nutrition, lifestyle perspective, and supplements and other medications. But sleep is one of those key things that is really worth mentioning, because all the benefits that are contained in sleep pertaining to the immune system. So when you are sleeping, your body is releasing peptides and hormones that are priming immune cells. Your T cells are becoming stronger. Your natural killer cells have enhanced response. So you have a significant improvement in your immune system if you are sleeping well. And so, I wanted that to be a key take-home point as well, especially with us now in the situation that we're in the pandemic. And, it's just as important a time as ever to be making sure that you're sleeping well. And we know that when we have a really bad night's sleep, then our immune function automatically suffers the next day, and our predisposition to catching a cold and these types of things are higher just with one night of poor sleep. So just imagine sleep night on night and how important that is. Melatonin is another important a compound that activates immune cells, especially T cells. So that can really help as well. We have melatonin naturally in our brains, and we can also supplement with it. Circadian rhythm is very important. So some of the key things you can do to help your sleep is to be sleeping at, trying to sleep the same time every day and waking up at the same time. Your bulk of your most restful sleep is going to be in the earlier hours of the night, 10, 11 p.m., 12 p.m. So if you're consistently going to sleep beyond that, beyond midnight, you're not going to get very restful sleep. And then fixing blood sugar. Fixing blood sugar is a key part of sleep as well, because when we have blood sugar imbalances where you have these blood sugar spikes during the day with eating excess refined carbohydrates, with strong insulin surges, then you can have situations where in the middle of the night where you're not eating, you suffer from low blood sugar or hypoglycemia, and all of a sudden your catecholamine response with your adrenals is kicked in because the body needs to survive. It will start pumping out your adrenaline, your noradrenaline, and it will eventually wake you up. And that's a big reason why people wake up at 3, 4 a.m. is because of hypoglycemia. They feel hungry, they feel anxious because of this surge in your stress hormones because of low blood sugar. So sleep hygiene is key. I know it's difficult for all of us with screens and phones and all of the things that we have now, stress and everything like that. But it's really something that we should all work towards, myself included, where we're trying to fix our sleep hygiene, where we're waking up in the morning and trying to get natural light the first thing in the morning, as opposed to many of the ways that we do things currently. So just sleep is a very key point, and I wanted to end it there. So just as a summary, autoimmunity is becoming increasingly important because our rates are skyrocketing. We want to make sure that we understand the mechanisms involved because it's much more complex than we treat it as, and we want to give it that due respect because otherwise patients suffer when we have unrealistic expectations, and we want to make sure that we're doing our best for these patients that are really suffering. And so, diet, lifestyle, nutrition, sleep, all these things play such a key role and should be tried and used before we even get to supplements and medication. And then there is a certain, so there should just be a nice way of doing it, as opposed to just taking a patient, putting them on the most dangerous, most expensive medications right off the bat. So we want to just take a very nuanced and kind of a detailed approach when we're dealing with it. And so thank you for your attention, and I hope you all were able to get some positive points out of here, and look forward to any questions. So thank you, and I'll give it back to Jenny.
Thank you so much, Dr. Akhter. That was great information. So our final presenter tonight will be our own People's Pharmacist, Kevin Natt. He's going to discuss gut health from a clinical and a wellness perspective. And I'm going to go ahead and put his contact information up so that you do have that available. And also don't forget to submit your questions for any of our presenters in the chat. The live QA will follow Kevin's presentation. So Kevin, the floor is yours.
Thank you so much, Jenny. And thank you so much to our other presenters tonight. It's been some really good information. So I actually don't have slides tonight. I'm going to be doing a bit of a show and tell. So if you do want my screen to be a little bit bigger so you can have a better kind of view of the supplements I'll be showing you, you can just hover your mouse over my screen and there should be a little push pin there. Should be the same thing on your phone as well. You can just kind of click my screen and the push pin will make me a little bit larger. That way you can see everything. But again, there's going to be a slide at the end that will show all of these so you don't have to write them down or take notes or anything. So again, my name's Kevin. I'm a pharmacist here at People's Pharmacy. I've been working here for over 8 years now. I started out as a technician, worked my way as an intern while I was in pharmacy school, and then I was hired on as a pharmacist here. So I've been doing that for about 3.5 years now. So tonight I just want to kind of speak to and summarize some of what the other presenters have, spoken about and kind of give you some options in terms of what People's can offer you. So like the others have mentioned, our healthcare system for some people can seem very segmented. You have cardiologists, endocrinologists, gastroenterologists, your general practitioners, and this is a good thing in theory. You want someone who's an expert in their field when you need it, but sometimes there's no cross communication. It can feel very disjointed, and it can feel like your body's not being treated as a whole system like it really is. The pharmacy is really where all of this comes together. We're seeing all of your prescriptions, we're seeing some of the supplements you're taking, and we can really make an educated, recommendation based on all of these factors. One of the reasons I love working at People's Pharmacy is we're an integrated pharmacy, meaning we have both a pharmacy and the wellness department doing supplements and herbs and phytomedicine, and we also have a deli. And again, these are all just kind of working together to promote overall health and wellness. So as Deborah kind of mentioned earlier, at People's we offer, just your regular prescriptions as well as custom compounded medications. We also have a whole wealth of wellness supplements, particularly some professional brands that you're not really going to find in the big box stores. Also, we have some healthy foods and a bunch of snacks. I think that might be one of the reasons why people like coming into our stores. But our goal really is to promote the public health and education. And me as a pharmacist, I really try to let people know that it's not just that, Western medicine prescriptions good, herbs and supplements bad, or vice versa, herbs and supplements good, can't do prescriptions. You can use these together safely when you're working with both an experienced practitioner and a pharmacy that really knows what they're talking about. So on to GI health. Decades ago, there was not really a lot of widespread knowledge about gut health and how it affects the rest of your body, maybe outside of just kind of general nutrition support. Nowadays, we have more and more information about how the gut, and particularly the gut microbiome and gut bacteria, really affects the rest of the body and vice versa. So if you look at animal models that have been studied, if you completely change the gut bacteria in a rat, you'll completely change the chemistry and the neurotransmitters in the brain. And kind of vice versa, if you exert stressors on a rat, you'll completely change their gut microbiome. So one of the kind of little tidbits that I think is really interesting, a lot of people don't know, is when you look at serotonin. So we use serotonin in drugs like SSRIs, the serotonin reuptake inhibitors, clinically for things like mood disorders, major depressive disorder, anxiety-related disorders. And a lot of people just think of that, okay, serotonin in the brain, good. A lot of that, 90 to 95%, is actually made in the gut, and most people don't really know that. Another thing is melatonin. We think of it as being made and secreted by the pineal gland, and that one, as Dr. Akhter said, regulates the sleep-wake cycles and circadian rhythms. It's also made in the enterochromaffin cells in your gut, which is the most populous cell throughout your digestive tract. So the gut microbiome, it really is very important for your overall gut health and just overall well-being. So the main question that I get asked as a pharmacist is, I'm on an antibiotic, do I need to take a probiotic? And for a majority of patients, it's a resounding yes, but they come in a lot of different flavors. So it can be sometimes hard to pick and choose which one that you need. So one of my favorites, and that's just for ease of administration, is actually Saccharomyces. So this is particularly helpful for people who have a complicated antibiotic regimen, if they're taking something 3 or 4 times a day. And best thing to do is kind of get the antibiotic in, let that get absorbed, do its thing, and then 2 to 3 hours later, take the probiotic. And sometimes, you're getting up to 5, 6, 7 times a day having to take something, and remember that. And with our busy schedules, that's not always possible. The good thing about Saccharomyces, which is also sold under the brand name Florastor, it's a non-colonizing yeast. So it can actually be taken at the same time as an antibiotic. They won't interfere with each other, and you kind of get the benefit of both of them. Saccharomyces is also good alone and in combination with other probiotics, particularly for patients experiencing diarrhea, whether that's just general diarrhea or antibiotic-related diarrhea. Another one that I really like is the orthobiotic. It's a great combination for just kind of daily use, has a kind of a moderate blend of strains as well as the Saccharomyces in it. Again, kind of just a good daily use one. There's another one called Claire Labs Therabiotic Complete. That's a refrigerated one, a really good blend of strains, which is, again, what we're looking for. We want diversity in our gut bacteria. I don't have it with me because it does need to be kept cold, but that's a really popular one that people really like. And the last one would be Probulin. So this is just their daily care probiotic. Again, if you look at the back, a lot of different strains in this one. And with this one, it's really good because they have a lot of different, targeted products. So there's the daily care, there's the colon care. They also have ones targeted specifically for women's health. Like I will have patients come in who say, they're picking up an antibiotic and they also have their prescription for fluconazole or diflucan. And, I'm talking to them and they say, yeah, every time I take an antibiotic, I get a yeast infection. Well, if you have a targeted probiotic or just a probiotic at all, we can hopefully in some cases minimize the need for the diflucan afterwards or completely eliminate it. So those are just a couple examples of the probiotics we carry. Again, there's a lot more. Outside of just the gut microbiome, there's also professional grade supplements that are used to kind of generally support GI health, permeability, overall function, and can help to reduce mild inflammation. And I say mild inflammation here because, if you have inflammatory bowel disease or Crohn's disease or something like that, you definitely should be followed with a, physician who knows how to treat that, knows what they're doing. If you're having a flare, you might need, an anti-inflammatory, a steroid or something that's worked for flares for you in the past. But there's other things that, you could take either during flares or after remission to, promote gut health overall, rather than just kind of relying on medicine whenever you're sick. The gut, as has been mentioned a lot tonight, acts on the immune system through immune exclusion. So it's absorbing nutrients, but it's also keeping out toxins and microbes and allergens. And we've heard that term leaky gut a lot, which is just increased GI permeability when your gut cells are so thick and inflamed that they're just kind of letting more in than they need to. There's a lot of products that can kind of help support a healthy digestive tract. One of them that we like a lot is the Designs for Health GI Revive. This again will just support, general GI permeability and integrity, and also intestinal health. Can also help reduce mild inflammation. There's one called Mega Mucosa. This one actually has a blend of amino acids that help support, the production of your GI mucosa naturally. And that again is just kind of the innermost layer of your GI tract, that's hitting the hydrochloric acid. It's basically a thick substance full of a bunch of stuff that's protecting the cells. It's full of, nutrients, and is also a physical barrier keeping, microbes and allergens out. The Mega Mucosa also has fruit extracts that support short chain fatty acid production via the microbes that are already in your gut. And these are things, the short chain fatty acids, that we can actually use clinically. Like in our lab here, we'll compound sodium butyrate enemas, which can actually be used as an anti-inflammatory for lower intestinal tract inflammation. The Mega Mucosa also has immunoglobulins, the IgA, IgG, IgM, and these are just supporting, digestion, detoxification, barrier function, and just your immunity. And one more on that topic is just the Numedica Immunogy PRP. This is one that, again, has colostrum polypeptides and IgG to support immune response, not only in the gut, but throughout the body. And on the topic of immunity, we also talked a lot about earlier about vitamin D. So I won't rehash all of that. That's been, said very eloquently earlier. But I want to add a little timely aside here. So some of the studies coming out of ICU patients diagnosed with COVID, we're finding that a lot of them are deficient in vitamin D. And, it's not necessarily that correlation means causation. It could just be the large subset of the population is deficient in vitamin D, which we know they are, especially nowadays as we're entering, into the colder months with less sunlight. But also when people come into the pharmacy and they say, hey, I'm healthy now, what's something that I can take to keep me healthy. Vitamin D is really one of my go-to options. So we have a lot of those, anything from just your basic kind of D3 supplement, lots of different ones that are both the K2 and D3 in combination, and you can get these in a lot of different doses. Here's another one with K2 and D3 as well. And then also, you know, the ADK products as well. We've got a couple options from this. Here's the Designs for Health one, and we also have the Da Vinci one on most of our shelves as well. So yeah, vitamin D3 is a great thing, you know, just kind of for natural support for your immunity. We also talked a little bit about melatonin earlier. You know, it's used in your sleep-wake cycles, helps to regulate all of that. There's some limited data that show it can support, you know, eye health, major depressive disorder, specifically for seasonal affective disorder. And also 2 small studies show that it could raise HGH levels in men to promote growth hormone and also increase muscle mass. So, but we carry it a lot of different forms. Most of the time when I'm recommending this to patients in the pharmacy, it's going to be used as a sleep aid. And so I usually tell people, you know, it's good for helping you get to sleep. It's good for kind of, you know, short-term occasional use. It's not something that I would recommend people be using every night. And the doses that are available are anywhere from a 0.5 milligram all the way up to 10 milligrams. Most people are going to be needing a much, much lower dose. You know, some of the ones that are out there on the market are much too high. You don't really need something that high of a dose, especially when you're first starting out. But we have a couple different forms. Again, lots of different things. I like the lozenges. That's the one that I use. And these are 5 milligrams. So you can even cut those up into smaller pieces and it'll still, you know, work great for some people. A spray is also one that people really like and works really well. And a lot of this just comes down to patient preference. There's also some formulas that are more herbal. This one is the Best Rest formula by Pure Encapsulations. It's a very low dose of the melatonin, about a 0.5 milligram, but it also has things like passion flower and hops and valerian root that just kind of help you get a better, well-rested sleep. So a lot of things that kind of come into play to make sure you're getting that good night's sleep, having good sleep hygiene and all of that. Another thing that comes to mind when we talk about gut health and, you know, speaking of melatonin is just general hormone balance. You know, when you have a healthy gut, when everything's balanced, your hormones tend to be, you know, a little bit better, and vice versa. When you have, you know, adequate hormone levels and they're balanced, your gut health can be directly impacted. One of my favorite things that we do and offer at People's Pharmacy is compounded bioidentical hormone replacement therapy. So things like progesterone, estrogens, testosterone, and we also do custom doses of thyroid medications. So with the bioidentical hormone replacement therapy, some of them are commercially available. So if you look at, you know, progesterone, it comes in 100 and 200 milligram doses, but they have peanut oil in them. So what do we do for patients who are, you know, sensitive to peanuts or who have a, you know, full-on anaphylactic reaction to them? Or take someone who takes a 100 milligram dose and it's not quite cutting it. Then they go up to a 200 milligram dose and they're having side effects, feeling really groggy the next day after. We could compound, you know, 150 milligrams or something like that. These are things that we can always, you know, work with your practitioner to kind of find the custom formula that's right for you. Something else that's really important is estrogens, specifically in terms of, you know, how you're taking them in the gut. These, again, come commercially available as tablets in a 0.5, 1, and 2 milligrams. But what happens when you take something into your gut is it's absorbed and it goes straight into the hepatic circulation. So it's going through your liver, and your liver is going to kind of chew up all of this, turn it into a bunch of different things. Some of these are things that we want, and some of these are things that we don't really want. There has been a lot of studies that link these metabolites from estrogen to the risks that we typically think of, such as blood clots and estrogen, you know, receptive, estrogen-dependent cancers, you know, popping up. So for a lot of patients who are worried about these risks or have a, you know, personal or family history of these cancers, a lot of times a different form is going to be better. You know, there are, you know, troches and RDTs that dissolve in the mouth, which is better, but still about half of that dose really gets down into the gut. So we're not completely eliminating that risk. Some studies show or support that using a hormone topically, so this would be a cream that's applied to inner wrist, inner elbow, inner thigh, can pretty much eliminate, if not drastically reduce, the risks that are associated with estrogens. So for a lot of patients, that's something that, again, we can, you know, talk to you about it, talk to your practitioners, kind of find something custom that works for you. We can combine different hormones into one single product as well. And lastly, we also do the thyroid compounding. For anyone who's taken a thyroid supplement, you know that is heavily dependent on what is in your GI tract at the time. Thyroid things like levothyroxine or Synthroid, you want to take them 30 minutes to an hour before anything else in the morning. You know, before food, coffee, the only thing you can take them with is water. And that's because their absorption is so erratic, anything else will just bind to it and make you excrete it. It won't really get absorbed. But they come in a lot of different doses, you know, so say you're on an 88 microgram dose and you're still hypothyroid, and then you go up to the 100 microgram dose and you become hyperthyroid. You know, we can kind of custom tailor a specific dose that, you know, keeps you level both in your blood draws and also in how you're feeling. One thing we also do is compound with the desiccated pork products. A lot of people really like these because they have both the T3 liothyronine and the T4 levothyroxine components. So it has a little bit of that thyroid hormone that's already activated. So, you know, instead of having to wait, you know, 4 to 6 weeks to really see the changes on your blood tests and see how it's going to make you feel, people tend to feel a lot better on these. So again, we can kind of custom tailor, you know, things based on your symptom evaluation, based on your blood tests, just based on, you know, conversations that we can have with your physician. So that's a little peek into what we have to offer at People's Pharmacy. I hope that was kind of helpful in, you know, tying together a little bit of what our practitioners spoke about tonight. And I just want to reiterate, you know, utilize your functional medicine practitioners, utilize your pharmacies. You know, speaking for myself, pharmacists are one of the most accessible sources of medical and healthcare information. And I am by means not the most knowledgeable pharmacist in the company about all this stuff. We have pharmacists who know way more about compounding, have, you know, specialized postdoctorate, you know, degrees and studies on herbalism and supplements, and, you know, are way more experienced with this. We also have herbalists and nutritionists and people who specialize in Chinese medicine and acupuncture on the floor in our wellness staff in all of our stores, who are very, very knowledgeable, have studied their whole lives with herbs and supplements. And, you know, you can give us a call. You can come into the store, see if we can find something that's going to really kind of help for you. So with that, I'm going to turn it back to Jenny. You're welcome to unpin me from the screen if you did that. That way you can see the slides for what's coming up here shortly. Thank you so much.
Thank you so much, Kevin. We appreciate you very much here at Peoples. And thank you also to our diverse group of presenters tonight. Right now, we're going to get ready for the QA. While we're doing that, I'm going to go ahead and put up a slide featuring some of the supplements that Kevin was talking about. And this is included in your slide deck as well. But because you attended this evening and we wanted to show our appreciation for that, we are going to be in your post-webinar email. You'll not only receive a recorded copy of tonight, but you'll also receive a coupon that is good for 20% off a wellness item. All of the items featured here in the slide that Kevin spoke about, we do have available in all of our retail locations. And if you do have any questions on that, please feel free to reach out to any of us. All right, so I think that we're ready to get started with our Q&A. So I'm going to go ahead and turn that over to our compounding pharmacist, Deborah Fernandez, to get things started.
Thank you, Jenny. So what I'm going to do is I'm going to kind of group the questions that have come in, and I'm going to redirect them to the according presenter. So the first group of questions is going to be specifically about vitamin D. And so, Kristine, I was hoping you could take some of these. And so the first question, one question that came in states, what amount of vitamin D intake poses a toxicity risk? And also someone posed the question, can you overdose on vitamin D? And so, Kristine, could you speak to that?
Okay, absolutely. So vitamin D, there is such a thing as vitamin D toxicity. You can overdose on these fat-soluble vitamins like the A, the D, the K, the E, but it takes a lot of vitamin D to overdose. I was looking at some some research and some papers and some information during the presentation, and just kind of getting that number. And what I've come across is you'd have to take like almost 60,000 IUs per day for months to get vitamin D toxicity. And what that looks like, it'd be like hypercalcemia. You'd end up hypercalcemic in your blood work. You'd start seeing kidney stones, things like that. It's very difficult to be toxic on vitamin D. You'd have to try really, really hard. And then the second part of that question was,
it was the same, like,
Okay.
can it be toxic? And the answer is yes, but
Yeah.
but you really would have to take buckets of vitamin D to
Buckets.
really reach that level.
Yes.
So that's not something that we are really fearful about when we, are recommending a 5,000 or even a 10,000 unit D3 in the pharmacy. Another question about vitamin D is that someone poses, does it matter if I take it once a day or once a week? And attached to that would be, my doctor gave me the D2, the 50,000 unit for once weekly, but I see that you have lots of D3. You only have D3 as a supplement. So I'll let you take a stab at that one as well.
Yeah, so D2 is what you will find mostly in the 50,000 IU dosage that you'll get at a pharmacy. What we find and what the studies show is that to really get those blood levels up to where it's getting into the cells, D3 is the preferable form, which you're going to get from some forms of your animal-derived foods and sunshine. So D3 is the preferable one. D2 is still going to be fine. Your body's going to convert it to the active form, as I showed you earlier, but D3 is the one we find affects serum levels most effectively.
Yes, and we do actually carry in our stores a 50,000 unit D3 capsule that is indicated to be taken, of course, once a week, and it has great results in increasing serum blood levels. So we likely recommend it for patients just once a week. The next question that came about was specifically about vitamin K2. And it was which form of vitamin K2 is better? It comes in two forms, MK4 or MK7. And so which is the preferred form, or is there one?
Now that question, I don't feel qualified to answer. Maybe there's another practitioner, or maybe even Kevin can answer that one better, or you can. The two forms I'm actually not familiar with. The ones that I typically use in the supplements that I have for my patients, I just know it's K2 and I look at the micrograms. So maybe one of you can answer that.
Yeah, I know personally a lot of the products that we carry will have one or the other, or sometimes both of them. I know from what I've read and the information I've kind of gathered about it is ideally if you can get something that has both forms of K2, great. I've read something that said that M7 was superior over the other forms, and I've kind of read different things that show kind of different results. So from what I've gathered, if you can get both of them in a single product, that might be your best bet.
Yeah, same, Kevin. I also read where if you were just taking a K2 supplement that was MK4, you have to take it, has a short half-life, so you would really need to do it more in a divided dose, whereas with the other form, the 7, that you could do a daily dose. So I think the answer is we don't really know which one is more beneficial. I think it's just most beneficial to add it to your vitamin D regimen, your supplement regimen. All right, thank you so much. So the next group of questions I'm going to target to Dr. Mehlenbacher. And so we had a couple questions come in. The first one is, well, what is your philosophy of practice and the background of your practice?
My philosophy, I mean, I feel like I explained my philosophy. Basically that the power that made the body heals the body. And I do believe that our body's oldest systems are the key to solving all our newest problems. I mean, that in a nutshell. I believe in all forms of healthcare. It depends on what you in your particular individual system needs. So it might be surgery and medication for one. It might be looking at your childhood experiences for another. It might be focusing on your diet, nutrition for another. It's not a cookie cutter approach. I think everyone is individual and it's multidimensional and it's complex.
Agreed. And so the next question was, what are a few ways that we can help foster a balanced gut microbiome within ourselves?
That also is individual. You know, I think people will love cookie cutter answers of like, just eat this and you'll be good, you know, just avoid this and you'll be good. Everyone is unique. You know, it goes down to your genetics, it goes down to your environment, it goes down to the pollution and toxins in your system. So, you know, finding someone that does what all the people on this list do, you know, finding someone that can look at you, give you a really good assessment. And, you know, we all end up having to be our own best doctor. And that's really goes down to figuring out what works for you. And for some people, they are deficient in bacteria, like, you know, they were mentioning about probiotics. Some people have too much, right? So to just give a blanket answer for that is difficult. I do agree with Dr. Omar. He has made a lot of great points. I particularly prefer eliminating the toxins, right? You can't dry off when you're in the shower. So if you're still bombarding yourself with toxins, stop consuming them or putting them in your environment. Repair and replenish what you're deficient in to build your system up to be able to detox whatever that is that's holding you back. And then your microbiome balances out naturally. You know, I'm a big proponent of travel and exposing yourself to new environments and new foods, right? The more diverse, the better. If you can have a new vegetable every day, that's ideal, right? You want to have the most diversity that you can, so that way the more monoculture we become, the more mono agriculture we become, that's when we get superbugs, right? So the more diverse, the better. And I would say the quick answer is find someone that does functional medicine that you trust and that can look at you particularly, because it can be your genetics, it can be your emotions, it can be different for each person.
Yes, and thank you for your answer and your being so candid, and also, but just reminding us that there is no easy answer. And so I feel like sometimes people ask us to, you know, give that one, you know, golden nugget, and the real answer is there's no one golden nugget. It's the big picture and all of it together. So thank you for reminding everybody of that. The next question is also for you, Dr. Mehlenbacher. It says, if you are comfortable sharing, how did you approach healing your chronic sympathetic shutdown?
Yeah, I mean, I went through the pyramid. You know, first I wasn't even at the point of being able to talk about, you know, the psychology and my beliefs. I just was surviving. So the physiology and the microbiome was my focus initially for years. And then I got to the point of really, that's when I got into functional neurology. So then I got into, you know, how the ears and sound meditations were so big for me. Learning those techniques to regulate my nervous system, you know, beyond just meditation, but meditation is huge, but just recognizing there's a great thing called somatic experiencing where you feel the thing, right? And you're like, you immediately we want to distract from the thing. Like, I'm going to grab my phone. I'm going to eat. I'm going to do the thing, right? If we just sit with the feeling and really tune in with like, what is my body telling me right now, and not running from it. And I did a lot of that. I've read so many, you know, self-help books. I've taken so many psychology classes. I talked with my parents for hours about things. I did family constellation therapy. I've done, you know, full psychological retreats. You know, I really am the type that just really dove into it. I became obsessed with this, like the way your beliefs and your thoughts and your patterns create your reality. So just taking it through the pyramid, you know, like don't just jump to what is my childhood trauma, you know, like yes, after you're a safe enough place in your system to really be able to rewrite those programs from an adult perspective. So I still say going through the pyramid.
Yeah, great advice. Thank you for that. The next question is, what are the key characteristics of an effective probiotic, and what should we be looking for when we're evaluating our options? And Kevin, I'm going to tag one more thing on that is, what about a prebiotic?
Gotcha. Yeah. So kind of like what Dr. Mehlenbacher was just saying, we're all unique snowflakes. There's not really going to be one best answer for everyone. You know, like with the probiotics, you know, they have specific ones that are targeted towards, you know, whatever you're trying to treat. So, you know, if you're just looking for a general, you know, daily care probiotic, ideally, you know, the best one is going to have a good mix of probiotic strains. Again, if you are someone who suffers from a little bit more on the diarrhea side of things, maybe adding something with a bit more Saccharomyces into that is going to be a little bit better. But again, it kind of, in general, you're going to be looking for something with a good mix of strains. In terms of the prebiotics, you know, basically what those are is essentially food for the probiotic. So, you know, it's going to be, you know, something that helps with the survival rate of, you know, those different colony forming units. Some probiotics even have, you know, delayed release capsules or specific technologies to help the bacteria survive in that gut transit. So that's something you could also look for. You know, the gut's a pretty harsh environment. When it goes in, it's surrounded by hydrochloric acid, and, you know, that can, you know, harm us. It's definitely going to harm bacteria. So, you know, finding a product that maybe is, you know, a little bit tailored to helping those bacteria survive a little bit longer in the gut could be a bit more beneficial as well.
Agreed. And along the same lines, you know, speaking of that, you know, we really do want to take our probiotics and prebiotics first thing in the morning or last thing in the evening on an empty stomach. That gives them the highest chance to survive that gut acid and make it all the way down where they can populate in the intestines. And so, you know, if you take them with food, it's a higher likely chance that you're not going to get your money's worth. So you really want to, preferably, again, on an empty stomach to get the optimal results on your probiotics. The next question says, patient, she has Parkinson's and a poor appetite, which also results in slow digestion. How can I improve these issues? Anyone?
That's vagus nerve territory. Hey, Karla.
I wasn't sure who was supposed to be talking.
Yeah, I just kind of threw it out there. It was a complicated one.
Yeah, I mean, Parkinson's is something that's gotten to the late stage of the disease. So still having to go back to the beginning of like what started the cascade in the first place, what started the disbalance or the, I'm getting flags on the computer. What started the immune response. And then you can look at the same thing with the nervous system. I mean, Parkinson's also has biases in the nervous system of typically one side is affected more than the other. That overall slowing and dopamine reaction is a complicated conversation. There's a lot of things for different people, but looking at those different motor patterns in the body and different ways that you can work with someone like me that does functional neurology, that can give you exercises to do to help try and reprogram. Once you're at the late stages, you can't really reverse what's happened, but you can slow the progression. And then, you know, I still go back through the pyramid, but with something that's in late stage, it's more of like, how can I slow the progression of this just going straight downhill? And you can really maintain with doing a lot of this stuff to make sure that you have as long and healthy life as you want.
Yeah, I agree. Thank you, Karla. I mean, I think, you know, you have to look at the overall minimizing inflammation. And so I think it's a big package of, that you can make those choices, eliminate those things, eliminate the things that cause issues, whether it's gluten or dairy, and making sure that your vitamin D levels are good. And, I think all of those things can help to decrease inflammation and help with any chronic inflammatory issue. Another question that came through was, how does the gut impact my neurotransmitters? And I know we touched a little bit on that. Dr. Akhter, do you want to answer that one? Anyone?
I think Karla, did you mention that in your talks with serotonin?
Yeah.
Yeah.
I did just bring it up. I don't think it's in my slides, but yeah, I mean, they say up to 70 to 80% of our serotonin is produced in the gut, because it's actually the bacteria that's doing it. A lot of our cravings and a lot of our mood is all regulated by what the microbiome is doing down here. And if our microbiome is full of candida and starving for sugar, then it's going to affect our mood, right? That's good. What's producing the serotonin. And it's also norepinephrine, epinephrine. So it affects your ability to want to be motivated, to want to move, right? So it's like it's a cascade effect, right? So it does start in the gut, but it's also the chicken and the egg, right? So once it started, it's both.
And then along the same lines, another question is melatonin produced in the gut? And so it is produced in the gut. And so the next question would be, what improvement would you see by taking melatonin other than sleep? And certainly you would see an improvement in your immune system, right? Because it affects your T cells. So that's something that we all, definitely saw, especially we saw increased movement of our melatonin supplements over COVID. Does anyone else want to speak to that?
Go ahead, Karla.
No, I don't mind if you want to speak. I was just going to say a lot of what sleep also goes back to that. What's your microbiome doing? There's a reason that people wake up between 3 and 5 classically. That's like the time. But that's because that's when our serotonin and melatonin will switch. And when we are primarily in that state of sleep, then that's when parasites and bacteria are reproducing, and it wakes us up. So if you're bombarded with these things like parasites and bacteria, you will have that like wake up between 3 and 5 stage. And it's like, is it that I'm deficient in melatonin, or is it that my gut is doing this in the first place? So it's same thing as like the chicken or the egg. So it can be from stress too. Like your DHEA is the start of the whole cascade. So it's looking, again, like finding someone that can look at it for you in particular. But I find a lot of these people that have sleep disturbances or melatonin issues definitely have disbalances in their gut. And that's what's keeping them up at night.
Mm-hmm. Yeah, it's very interesting when I talk to patients, helping them understand how important their gut truly is to their overall health. They sometimes don't understand that, especially long term, because you have to it's not something you're going to cure overnight. Leaky gut takes months, takes several different things to support your gut. And then the vitamin D additions as well. And speaking of COVID, the more and more continuing education I do about COVID and therapies, it includes melatonin, it includes high dose vitamin D, along with several other medications used off label to help with COVID. But one of the best things you can do is, if you are sick with COVID, is to work with your practitioner and make sure you do have melatonin on board as well as vitamin D.
Agreed. And so the final question of the evening goes to you, Dr. Akhter. And the question is, does cross-sensitivity depend on an individual's genetic makeup and diet, or do certain foods and or protein combinations tend to be cross-reactive?
Yeah, so that's a good question. So definitely certain food and protein combinations are cross-reactive. And I showed that little picture at the bottom of one slide where you can see a food antigen, and all foods that we consume start off as antigens until they're broken down. And you can see that when the amino acid sequence is similar in two particular food combinations, then they tend to be cross-reactive. So your immune system will react against one and against the other as well. So definitely certain food and protein combinations tend to be cross-reactive. Now, one key thing to remember is that when you talk about someone, like an individual, their genetic makeup and their particular autoimmune disease, that's where it gets so individualized, where one person's, I really can't give a certain diet to all autoimmune patients, because each autoimmune patient will have their own food sensitivities, intolerances, depending on their situation and their, for example, someone with Hashimoto's is a much higher tendency to have gluten sensitivity as opposed to someone who may have some other autoimmune condition. So from that perspective, your genetic makeup and your particular diet is going to be, and your particular autoimmune condition is going to be very important in determining what types of cross-reactivities you develop and what types of foods that you eventually react to.
Great information, Dr. Akhter. I think the Q&A is my favorite part of the presentations, because one question begets another question and really makes us think how everything is so interrelated. And I cannot thank our presenters enough for their wonderful pieces of valuable information to take forward. And so, Jenny, I'm going to pass it back to you. Jenny, is she there?
I got kicked off the call, but I'm back.
Okay, there she is.
All right.
Technology.
Yes, thank you so much again to all of our presenters and our guests for attending this evening, for making this a great webinar. For physicians and patients who want to connect, please be sure to send us an email or give us a call, and we'll make sure that you link up. And again, thank you to our presenters tonight and to our People's Compounding Center team for a great webinar. So we will see you all next time.